Hello, I'm Dr. Caroline Novak, a vein doctor at the Spider and Varicose Vein Treatment Clinic, part of the VIP Medical Group. I refer to myself as a vein doctor, but technically, a vein doctor is called a phlebobologist. Today I'm going to explain what kinds of doctors become phlebologists and how vein treatment has changed over the years. Vein disease, also known as venous insufficiency, is a disease caused by valvular dysfunction in the veins within the legs. Valves are one-way doors found within veins all over the body, but particularly within the legs. Blood flows up towards the heart and the valves close, stopping the blood from going back downwards towards the feet. Over time, if you have a family history of vein disease or other risk factors, your valves may stop closing properly and blood leaks back downwards. The veins below the valve may become swollen and congested, and new varicose and spider veins may form on the surface of the skin. These unhealthy veins may cause symptoms such as heaviness, aching, restlessness, fatigue, and cramping. Over time, this can lead to complications such as blood clots or wounds called venous ulcers. In the past, this common health condition was treated primarily by vascular surgeons, who would surgically remove the saphenous veins, the primary culprits responsible for vein disease. Doctors would take a series of incisions along the leg and actually pull out the vein piece by piece, tying it off in some areas. Unfortunately, this treatment was associated with significant complications, including high rates of wound infections and time spent in bed. Even worse, vein surgery, or vein stripping, wasn't very effective in the long term, with up to 20% of patients experiencing recurrent disease at 5 years. Medical technology for varicose vein and spider vein treatment has changed dramatically. Now, minimally invasive technology allows doctors to treat veins without making a single incision. Endovenous ablation, the best and most common way to treat venous insufficiency, involves insertion of a thin device inside the vein using a needle under ultrasound guidance. Medication is injected around the vein, and the device delivers heat to the vein, sealing it closed. Over time, the vein is reabsorbed by the body. This procedure is associated with minimal discomfort, just the pinch of the initial numbing medication only, and does not require any anesthesia. My patients often tell me that the most uncomfortable part of the procedure is my awful jokes. There's no downtime, and endovenous ablation is much more effective than surgery over time. So since most of the treatments for vein disease aren't surgical, what kind of doctor can perform them? The short answer is that any doctor with a procedural background and strong ultrasound skills, including cardiologists, anesthesiologists, other kinds of surgeons, including plastic surgeons and cardiovascular surgeons, can perform vein procedures and call themselves a vein doctor with proper training. At the VIP Medical Group, our medical directors are Harvard-trained experts recognized by major device manufacturers like Medtronic, pioneers in the field of vein disease. We emphasize a prolonged period of clinical training, and we only hire the best doctors with outstanding educational background and clinical acumen. Our doctors work to achieve formal certification and recognition in vein treatment by the American Board of Venous and Lymphatic Medicine, and many of them also have expertise in areas such as vascular imaging. So a vein doctor is called a phlebobologist, and you should look for a physician with strong ultrasound skills and experience with the latest technology, including endovenous ablation, sclerotherapy, and VenaSeal or vein glue. More important, you should feel as though your vein specialist takes the time to really listen to you, to address all of your concerns and answer all of your questions clearly, focusing on you as an individual. We hope this helps you find a good vascular doctor to address your venous insufficiency. You can find us online at www.veintreatmentclinic.com. I'm Dr. Caroline Novak, and we look forward to helping you.